Welcome to Sahara TV. Joining us now is Dr. Marcus Inyama, a senior physician, to shed light on a controversial case involving a court-ordered blood transfusion that never happened, thanks to a successful bloodless surgery. Dr. Inyama, thank you for being here with us, sir.
It's a pleasure to be here. Thank you.
Doctor, could you briefly walk us through the child's condition when they were first admitted and how your team approached it medically, sir?
Thank you. Actually, I was just invited to be part of the managing team.
Right.
It is the pediatricians that were actually the primary physicians responsible for caring for this child.
Okay.
And what they saw was a very, very anemic 2-year-old child with high-grade fever, up to 38.9 degrees. That's quite high. And the quick malaria parasite test that was done, MP, showed traces of malaria, even though treatment had been initiated from the hospital that referred her to the children emergency of the University of Calabar Teaching Hospital. And the clinical parameters were not good. With a baby of that nature, very high fever, swollen limbs, and in imminent or in anemic heart failure, so to put it. The first thing that came to the mind of the physicians was to transfuse the baby. And that is where I came in. The hospital liaison committee of Jehovah's Witnesses were there, and they requested that if they could look at the alternative to blood transfusion, for which they obliged, and they sent a consultation to the bloodless medicine and surgery unit of the Department of Hematology. That's where I
I believe you can hear me well, sir.
No, pull over. So we initiate, yes, that
Go
with
ahead,
malnutrition, yes, with malnutrition, we saw that this child has nutritional anemia in addition to high parasitemia that they came with from the peripheral hospital. And that if all these are taken care of, there will be no need for blood transfusion. So we initiated the process of treating this child without blood transfusion. Unfortunately, the initial team that saw had escalated that anemic heart failure and initiated the process that led to a court order 3 days after. Fortunately, not too long after I got the consult, I sent a senior registrar who reviewed this child and then he instituted treatment that will not involve blood transfusion. And it was initiated about 4 hours after. The following day, I was in a ward round and I saw this child. The child was doing well, eating well, communicating with everyone around. And we never saw any dangers until the 3rd day when I was called that someone has brought in a court order to forcefully transfuse the baby.
All right, doctor. You chose bloodless approach in this regard. For our viewers who may not be familiar, what exactly is bloodless surgery, and how viable is it in cases like this, sir?
Okay. It is not only bloodless surgery. Some call it transfusion-free medicine. Some call it transfusion alternative. Some call it transfusion avoidance practice. These are some of the names that have been used to apply in a practice that deliberately aims to treat a patient, whether surgical or medical, in a way that will avoid blood transfusion. It's not aimed, transfusion is not in the picture, the way the patient is treated. So if you look at it from that perspective, whether it is a medical case or surgical case, there are techniques that have been practiced worldwide over the ages that have worked out well. Complex surgical cases like open heart surgeries have been conducted without blood transfusion. In fact, Denton Cooley that started this process conducted up to 500 open heart surgeries without blood transfusion. The three pillars of bloodless medicine and surgery, or transfusion-free medicine, whatever you call it, are very, very clear. And it has been adopted in the patient blood management program, for which the World Health Organization has also subscribed to and has advocated it and actually advised that all stakeholders should aim at using this mode of practice because of the multifactorial benefit that goes with it.
Now, doctor, may I ask, are there risks actually involved in refusing blood transfusion, and how do you mitigate them, sir?
Okay. Just as there are some serious side effects with blood transfusion itself, there is also side effect for something you could expect to go wrong for not taking blood. And that is why, for those that say they don't want blood, they actually aim to get the best practice. That is, look at every parameters that should be taken care of. Once all this are taken care of, usually it mitigates the risk associated with that decision. And the outcome, when compared to the group that will take blood transfusion, are usually better in all the parameters.
Now, I may ask, sir, is this part of a growing trend in Nigeria, for example, and or is it still considered a niche practice, sir?
It is growing in Nigeria, but in Calabar, it has over the years, about 10 years now, grown to a very big organization that has promoted the practice of bloodless medicine and surgery. And we could say we are the hub in Africa. And all over the world, it has been going on in Australia, in America, and Europe, and they all have embraced this actual method of practice. But it is still very young, or just not overall generally accepted yet all over the country, but it is picking up. For instance, University of Calabar Teaching Hospital, for instance, most of the doctors are very, very good in terms of carrying out complex surgeries without blood transfusion, including medical cases. We've been doing well in this center in regards to this aspect of care.
Now, the child has reportedly been discharged based on what we heard and is doing well. How did the family respond to the outcome, sir?
The family, they are very grateful that their child was not forcefully transfused. That's first and foremost. But primarily, they are even happier that the child had made improvement. At the time the child left the University of Calabar Teaching Hospital, the PCV was 12%. As of today, the PCV is 21%. Color has come back to the body, and the child is now playing, accepting food, and is doing very well. So that has made the parents to be very happy, and their decision not to allow their child to be transfused has been vindicated.
That's great. In your view, sir, I mean, if I may digress a little, as far as this matter was concerned, was the hospital prepared for either option, whether transfusion or non-transfusion, depending on the child's response, sir?
The hospital is poised to carry out this aspect of care. Like I said, most of our doctors are aware and they are doing well in terms of taking charge of a situation where transfusion is not in the picture or is not considered. That's why when the entire picture was presented to management of the hospital and they saw that the child is doing well and could do without blood transfusion, they kindly obliged and allowed the child to be treated without blood transfusion.
So finally, doctor, what message will you give to both medical professionals and the public about balancing faith, science, and patients' rights in critical situations like this, sir?
Doctors who advocate for blood transfusion are doing their work and they're right. And when it comes to child care, the addition to transfuse, I believe, it's a professional decision which nobody can be faulted. However, the way blood transfusion is prescribed doesn't seem to take into cognizance the proper or due process. Now, if a patient presents is anemic and there are 1, 2, 3, 4, 5, 6, 7, 8 decisions to be made, it is likely that among those steps in an anemic patient or child for that matter, if people who are a lot more competent or willing to deal with a matter without blood transfusion, it should be one of those steps or parameters. It is when that has failed that transfusion should come at the last. But when transfusion is kept at number one, you see a child is anemic transfusion, that's where we feel that due process have not been followed. So we advise that in a situation, especially in an unconscious patient or in a child like this, as we are talking about in this index case, we had already come in to commence treatment without blood transfusion. There was no need to have escalated the matter to get an order to forcefully transfuse. The process is that, is there any alternative that can work well like blood transfusion in this patient? If the answer is yes, everyone should support that process. And where I am not competent to handle it, I should call those who are competent to do it. Where I'm not willing to do it, I should call those who are willing to handle such a matter without blood transfusion. It is when all that steps fail, for instance, that one will say, okay, we need to go to that. But in this case, and in many instances, that is put as number one, which shouldn't be.
Any final thoughts, sir, for our viewers on this regarding this matter, sir?
Thank you. Doctor, I didn't get that.
Do you have any do you have any final words for our viewers with regards to the use of bloodless surgery and in medical procedures, sir?
Okay. Now, there are a lot of cases in oncology, in pediatrics, medical, surgical cases. There is a lot of progress that has been made whereby patients are treated and cared for without blood transfusion. Last year, we managed a patient with hemoglobin of 0.9 grams, not up to 1 gram, and the patient survived. It's still going to be published. So anything is possible where there's a will to respect the autonomous right of the patient and let the patient be part of his or her care, especially when such patient indemnifies the physician and say, look, if anything happens to me, if I don't want blood, you are not guilty. If such a patient put such a decision down, we should be free to go ahead and treat. And where I don't have the competence, I should also refer to those who will be able to carry out such an order.
Dr. Marcus Nyama, thank you so much for your insightful perspective. We really appreciate this.
Thank you. Thank you.